Hello, and welcome to the Preceptor modules created by the Professional Development Department of the College of Nursing of Michigan State University. Module 5 covers the strategies of precepting high and low performers. Today's activity will provide 0.25 contact hours of continuing nursing education. Michigan State University College of Nursing is accredited with distinction as a provider for nursing continuing professional development through ANCC. Completion criteria for this continuing education activity: participation in the learning activity, achievement of 80% or greater on a post-session test, and then completion of the post-session evaluation. The learning outcome today is that upon completion of this learning activity, participants will have improved knowledge and provide a practice application example of strategies for precepting lower and higher performing learners. So like I said, today we're covering strategies for precepting high and low performers. My name is Catherine Kowalski. I'm a nurse planner and an assistant professor for the College of Nursing, and this was put together in collaboration with Dr. Larissa Miller. So we're going to dive into kind of what are the differences between higher and lower learners. And this kind of goes into Bloom's taxonomy of the cognitive domain in really understanding the lower order of thinking skills as well as the higher order of thinking skills. So at the base of it, your lower level thinkers or your lower performers often are kind of hanging out in these categories of remembering and understanding concepts. They may be able to apply some knowledge, but really truly, they might be struggling with current expectations on those foundational knowledges, such as remembering facts about medications or understanding a disease process. Your higher order thinking skills, so your higher learners, they often are in these next stages of really being able to analyze, evaluate, and then kind of create something new or process the information. And these higher learners, they really need to be challenged more at a system level to understand evaluating care processes and then creating new care approaches. As a preceptor, it's really critical that you understand where your learner fits within this and then the different levels of achievement so that you can help successfully coach them and mentor them through your preceptorship. Now, the concept of varying instruction to the learner, right? Should I vary my instruction based on the learner? I thought we should really treat like all students equally, right? Well, there's a why and a how, right? So leveling your instruction based on where your student or your learner is at and understanding kind of their needs as well as their kind of educational level really allows you to kind of vary your teaching methods to allow for better, more focused learning and success of the student. Understanding the student or the new nurse's kind of unique areas to both their strength and their challenges allow you as a preceptor to use targeted interventions, help them support, and then foster professional growth and practice. By providing personalized instruction and evaluation, you're able to learn characteristics such as their learning style, their cognition, their physical ability, some emotions, and kind of effective readiness. And then you're able to help them support that and then use what's going to be best for the student for them to be successful. How can you do this? So through pre-assessment, by identifying where the learner really is with their knowledge and skill, and kind of continuum is essential throughout your preceptorship. So they may start with you kind of at a lower level, and then as you're coaching them through, have you kind of reassessed their knowledge, gaining their understanding and where they're at, right? And then continually making sure that you're checking in on this instructor and student relationship, fostering a relationship and trust, and then make sure you're maintaining that to emotionally, physically, and kind of educationally support the learner. So, next, we're going to dive into competency based education. What is it, and how does it support lower and higher level learners? So I think it's really important to outline the American Associations of Colleges of Nursing essentials and the approach to competency-based education. There was really a call to transform how we think about clinical nursing education to ensure that our classroom teaching and our kind of core curriculum is really transferable into practice. And this allows the student to be a little bit more competent within their practice when they're entering the field. So, competency based education or instruction really allows a student to kind of advance based on their ability to master a skill or a competency at their own pace, regardless of the environment. The method is kind of tailored to meet the different learning abilities and can really lead to more efficient student outcomes. Competency based education really shifts from that primary focus of education to a more desired outcome of the learner rather kind of than your older education model or traditional education model of the structure and processes. And then competency based education is a way to really ensure that all students really receive individualized educational plans, setting them up for really more personalized success and support. And you can do this, and this will make you successful throughout your preceptorship by making sure, again, that you're individualizing the educational experience to your learner so that they're achieving the outcomes based on their kind of pace of the competency within their environment. So now that we understand competency-based education and really how it can impact our support for higher and lower level thinkers, we want to understand strategies of where to start when we're assessing learning performance as a preceptor. So where do we begin? Beginning assessment starts the first day of your interactions with the student. Whether this is a discussion with them of where their goals are, what their objectives are, strengths, areas of weakness, but then also the first day that you're with them in the clinical environment, doing observations of your own, understanding and maybe kind of trying to process where you think that the learner is at. And then providing clear communication with unit leadership, course faculty to really ensure that utilization of resources is best shared and kind of understood. And then navigating emotions. And this is on both ends because it can be really challenging with more so lower level thinkers or lower performers, but really compassionate, emotional, intelligent for any learner can really help foster that instructor and kind of the learner to really navigate through any challenging interactions. And then really just keep in mind, keep things realistic, keep them clear, keep them measurable, right? Can the student achieve the goals in which you're setting and within the time frame that you guys have together? So now we're going to really jump into how you as a preceptor can really support a lower level learner or a lower performer. And there's 6 concepts here that I have outlined. And we'll kind of break them down first and then really kind of apply them to practice. But the first one is identifying learning needs. So this, again, we already talked about it, but it starts day 1 of your interaction. And it should be a continuum throughout the preceptorship, but conducting those regular assessments to really identify if there's any specific learning needs or challenges when it comes to low performing students. And then the next one is providing constructive feedback. It should be offered timely. It should be focused on specific areas of improvement. It should be actionable, supportive, goal-oriented. For more direct information on feedback specifically, we have 2 modules, one on basics as well as advanced feedback to kind of help make you successful in your preceptorship. Then utilizing differing teaching strategies. is so beneficial when a preceptor can really tailor some of these strategies to accommodate different learning styles, whether it's, doing more hands-on approach or using role playing or concept mapping to enhance comprehension for lower level performers. Utilizing support services, so providing that kind of foundation of trust within your preceptor or preceptee relationship can really help you support and connect the student early to the resources they need. Whether you identify that it's an academic support resource, whether it's, more tutoring or, maybe giving them study tips, or if there's any non-academic stressors that you've identified, because such as mental health struggles or even physical conditions, because these can really directly contribute to academic or performance struggles. Then being able to give unbiased remediation plans. So when needed, we really want to develop an individualized approach for a lower performer that outlines clear objectives, provides resources, and then timeliness for their improvement. And really, you should want to collaborate with the student directly so that you can address their learning gaps and monitor their progress. And then promoting self-care practice. So educating lower level learners, and to be honest, all level learners and yourself, on the importance of balancing things like stress management, mindfulness, work-life balance, because mental health and supported well-being are really essential to being able to show up as a learner and perform within the learning environment. So now I wanted to take these kind of areas or concepts and really give you some practice application examples of how you can use this as a preceptor to really support the lower performer. So again, identifying learning needs. This again starts the first day of the preceptorship and asking those important questions of understanding student perspective of what their strengths are, maybe what their challenges are, set of goals together, what are their objectives, what do they want to learn with you, and then also doing assessments of your own of the student to really understand and ensure that you understand where the level of the learner is. Providing feedback, scheduling that one-on-one time, whether it's weekly or daily after your clinical together, but really discuss those deeper details: clinical performance, their strengths, areas for improvement. Don't let things compound by not addressing them, because then that puts the lower performer at a disadvantage because you're not identifying needs or changes that need to be made. Utilize different strategies for teaching. So if you have somebody who's really struggling with those complex processes, break them down into a timeline or a series of steps. Support them with anything that they need, whether academic or personal support resources, or connecting them with faculty so that we can help support these. But these are looking out for things like, is your student, are they, do they have transportation? Do they have the technology or the support services that they need? Are they getting regular sleep, right? And then implementing those unbiased remediation plans, really having the learner help you develop what the remediation plan is to best match their kind of style, but also enhance their performance. And self-care practices, coach them through stress management, mindfulness, kind of that work-life balance, and how to help support their well-being. Now we're going to transition over to more of your higher learner or higher performer and how you can help them as a preceptor. And so again, there's 6 concepts here that we're going to walk through and then do some of those application examples within the clinical environment. So challenge them with complexities. Higher performing students they thrive on increasing complexity of their patients. Offer them the chance to enhance their critical thinking and advance their clinical reasoning through complex patients. Encourage autonomy. Allow a higher performer student to take on more responsibility, whether this is in patient care activities or contributing to things such as patient rounds or giving off report. This can enhance their progression of their professionalism and really promote that confidence and independence in their practice. In mentorship, provide them with opportunities to pair them with somebody who has varied experience from your own. This can help them really give personalized guidance, career advice, networking opportunities to really support their professional growth and development. Encourage system level thinking. And what I mean by this is get them involved, whether it's something like nursing research activities or doing a hospital wide collaboration, broadening the students' kind of interdisciplinary interactions, such as, grand rounds, attending a grand round. They can really benefit from understanding the more broader system level thinking. Utilizing reflective practices, so incorporating things within your practice to kind of do those debriefing sessions, do those self reflections to really promote continuous self improvement. And then offer specialized educational opportunities, whether that's connecting the student with an opportunity beyond the current role, if it's an option. You could get them into a different clinical practice or clinical specialty area. And then that can really help satisfaction and retention. And then again, I wanted to take these concepts of the precepting the higher performer and put them into practice of what does that look like? What can I do as a preceptor? So again, challenging with complexities, increase their patient load or the acuity of their assignment. This really fosters that critical thinking, that interdisciplinary collaboration. Encourage autonomy, right? Allow the learner to discuss their thoughts on clinical decision making, maybe within the interdisciplinary team during rounds, right? Have them give report on the patient. Offer mentorship opportunities. Pair them with a nurse manager, a nurse leader, a charge nurse, maybe an alternative assignment in a specialty area. Those system level thinking. So engage them in quality improvement or nursing research within your unit or organization. Use reflective processes. So self-assessment activities to really understand and promote continuous self-improvement. And then offer specialized educational opportunities, whether that's observation of a different clinical practice or area, such as critical care. Include them in nursing research, healthcare policy, and other organizational endeavors. This concludes the module for precepting higher and lower level students. I hope that you enjoyed this information, and please let us know if there's anything that we can help support your learning needs more. Here are the references for this presentation. Here is the post-test and evaluation link and QR code. You can go ahead and scan the code with your phone and it will take you to the post-test. Once you have successfully passed the post-test with an 80% or greater, in which you have unlimited attempts, it will take you through to the post-session evaluation. We value your feedback and your comments from today's learning session. And once you have completed that, you will receive your contact hour certificate to the email that you provide. Thank you again for joining us today.